Assalamualaikum and hello guys, welcome to Carnation Space. So we are going to cover the management of obesity 2004. So let's start. Before that, basically what we're going to cover is very simple. It consists of only first we must know the definition of obesity and what are the etiology of the obesity, what are the obesity therapy, what's the goal, and then we move on to the pharmacotherapy, dietary behavior therapy. Alright, and also some of the management in childhood obesity. So basically, this is a summary of this whole CPG. What I want to say here is that the waist circumference actually contributes to the abdominal fat content. And then we must know the definition of the overweight is BMI more than 23 kg per meter squared, and the obesity is when the BMI is more than 27.5, okay? And then for men, the waist circumference is more than 90 centimeter, and for women it's 80 centimeter. Okay, let's move on. So what's the definition? As we already say that, so it says here, it characterized by the excess body fat that causes the obesity, and generally the men, they have more than 25% of body fat, whereas the woman is more than 35. So physiologically, women have more body fat than men. So this is how we calculate BMI. I think everyone already know that, so we just keep that. Alright, so this is very important. Let's look at table 1.1 here. So how are we going to classify? We have underweight, overweight, and then obese. So as we already say that overweight is when the obesity is BMI more than 23 and obese type 1 is 27.5, whereas we have morbid obesity when the BMI is more than 40. Alright, and then the waist circumference, already we say that. So what are the health risks associated with the obesity? Where we have people with obesity, they can have diabetes, gallstone, metabolic syndrome, coronary heart disease, cerebrovascular disease, cardiac failure, hypertension, osteoarthritis because of the weight bearing at the knee, and then some other like polycystic ovarian and fetal defect. Alright, so yeah, this one we can skip that. Alright, so there's a condition, metabolic syndrome. So what is it? It is defined as a glucose intolerance, okay? And then not just that, it consists of two or more of the following list. So first, patient will have impaired glucose tolerance, and then the insulin resistant, and then when the blood pressure, their blood pressure is more than 140 over 90 millimeter mercury, triglyceride of 1.7 more, and then their HDL is less than 0.9. This one is for men and this is for women. And then when they have central obesity of 0.9, and for women 0.8, and also microalbuminuria of more than 30 milligram per gram, the albumin creatine ratio of more than 30, okay? And then basically patient with obesity, they will have breathlessness because of the abdominal pressure, they would have sleep apnea, and also they may have eccentric ventricular hypertrophy. And regarding their fertility, also because of the anovulation cycle. Alright, and then what else we have? So why do we concern about obesity is because of the benefit. When we want to aim for the weight loss, why? Because the weight loss can affect their blood pressure. We can reduce of 10 millimeter mercury in systolic, 20 millimeter mercury in diastolic. And regarding their lipids also, there's 10% reduction in total cholesterol, and their HDL also increase of 8%. And also in diabetes, there's 50% reduction. That's very high, 50% reduction in risk of developing diabetes. Okay, and of course, when they are uh, reduce their weight, they put less pressure on their knees, so they may have less osteoarthritis, and of course, at the end of the day, their mortality rate also decreases. So what are we going to ask when we encounter with patient with obesity? We are going to ask about their eating habits, whether their food choices, the calorie, whether they have snacking habit, and then their physical family history of obesity, diabetes, hypertension, and also psychological regarding their self-image, or is there any related eating disorder. Our physical examination consists of examination to see if the patient have sleep apnea, and also we want to use the correct size of cuff to measure their blood pressure. And then, because of the metabolic syndrome, we want to know whether they have impaired glucose tolerance. So we're gonna do this fasting blood glucose to find about that. And then lipid profile, we also want to see their uric acid, renal liver function test. And then if indicated, we will do also 24-hour urine-free cortisol, especially if regarding Cushing's syndrome. Okay, let's look at here 2.2.3 about waist hip ratio. Okay, so there's this thing about waist hip ratio, so keep in mind the waist hip ratio for men is 0.9 and for women is 0.85. Okay, so how are we going to measure the waist? Which part of the body we want to put the measuring tape? So we put at the inferior margin of the last rib and the crest of the ilium in the horizontal plane. Okay, alright, and for the hip circumference, we put it at the protrusion of the buttocks. I think you all can imagine that. Alright, when we talk about cardiovascular risk factor, look at here, at bottom here. For their high LDL cholesterol, their cardiovascular risk factor is when they have more than 4.13, and low HDL is defined as 0.9 less than that. Okay, and then there's hypertension, and then cigarette smoking that leads to cardiovascular risk factor. And then for the age of more than 45 and the female of more than 55. Okay, but we must also remember that there are sometimes people who have obesity because of their endocrine illness, like hypothyroidism, polycystic ovarian syndrome. Okay, alright, so let's move on to section 3. So we want to achieve weight loss, right? So how much weight loss do we want? It is when more than approximately 10% from baseline, okay, or 0.5 to 1 kilogram per week in 6 months. Okay, let's say if the patient is 70 kilogram, so if we want to lose 1 kilogram in a week, in 6 months, in 6 months, the weight loss can be calculated about, how do we do this math? Alright, let's take 10%. Okay, 10% from the baseline. That means the patient is going to lose 7 kilogram. So in 6 months, we are expecting the patient to be 63 kilogram. Yeah, that's easier to understand. Alright, let's move on. Okay, so how do we achieve this weight loss from our dietary? Is when we reduce our intake by 500 to 1000 kilocalorie per day. Usually patient who are okay later at this one point we will cover about that. Okay. Yeah. So and then after we lose the weight, we want to maintain the body weight. So what is defined as maintaining body weight is when the weight gain is only less than 3 kilograms in 2 years, and then the waist circumference is 4 centimeter. Alright, this one I don't want to cover, you can read on your own.